people that are going to make the difference when we get down to voting in the House of Representatives, then when the Senate votes, and then when it comes back and we have to vote on a merging of the House and the Senate legislation. You are the ones, and it's going to be your voices that have to carry the day, because you certainly know you have me. There's no way we're going to have health care reform unless we have a robust public option. I am the chair. I co-chair, actually. This is my third term, my fifth year of co-chairing the Progressive Caucus, the Congressional Progressive Caucus, which is the largest Democratic caucus in the House. We have 85 members. Two of those members are senators. But certainly they're all Democrats. The Progressive Caucus, to a member, would have voted for a single-payer healthcare system. But there's 85 of us, and there are 435 members of Congress. That doesn't make 218, which is what it takes. So the Progressive Caucus said, we will compromise on one thing. If we can get a robust public option included in the health care reform, we will back the health care reform. But I said it, and I'll say it again, without a robust, and I'm going to tell you what robust means in a minute, public option, health care reform will not be meaningful. Robust means using the Medicare provider network so that the public option doesn't have to, the public option doesn't have to renegotiate with every provider in the country, which would take years. Using the Medicare rate system, it could be Medicare Plus, but using their rating, their fees, so that we don't have to negotiate fees with the private health insurance industry. And it means providing choice for all Americans with their health care. And why do we care about that? We care about it because without it, we continue with exactly what we have today. We're going to tweak it, and I'll tell you what we're going to do to make things better all the way around, but we're going to tweak the health insurance industry and make them do better. But that's not enough. Without insisting that there is a choice and competition to them based on a public plan, because you see, a public plan does not have the 30% overhead that the private industry has to support. So that 30% that we won't in the public plan be spending on shareholders, won't be spending on marketing, won't be spending to ensure that our CEOs are paid in the 7 figures, will mean that we can take that 30% and invest it right back in, guess what? Right. Health care. If we get the plan that the progressives want included in the health care reform, then we will have a path to a single payer or universal or Medicare for all health care system in the United States of America. If we don't get that, then we're right where we were, except we're going to do some pretty good things. In the future, there will be no more pre-existing conditions, no matter what. If an individual gets sick, they can no longer be exited from their health care plan. And if an individual loses their job, changes jobs, or their employer stops providing coverage, then they do not lose their health care. So those are all good things, but we have to have more than that, because the cost of health care will not be leveled off unless there's competition to the private insurers.
Right.
Private insurers have had a long time in the United States of America to do it and do it right, and for some reason they either can't or won't, but it isn't happening, and it will not happen in the future without competition. So I thank all of you, because you're going to insist that your legislators, well, you've got me and Mike Thompson, for heaven's sakes, you know. But don't think that there aren't others who have to